الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Clinic of Occupational Radiation or Occupational Radiation Clinic by Professor Mahmoud Hani Sulaiman. What is radiation? Radiation occurs in occupational exposure by two main types, ionizing and non-ionizing radiation. So, ionizing and non-ionizing radiation. Ionizing radiation, IR. These are radiations traversing air, causing ionization of the matter to positive and negative ions. These ionizing radiation include X-rays, alpha, beta, gamma radiation. X-rays, alpha, beta, and gamma radiations. This diagram shows non-ionizing and ionizing radiation. On the left side is the non-ionizing types, and on the right side is the ionizing types. As you see, the ionizing are gamma rays, X-rays. The non-ionizing are extremely low frequency, radio frequency, microwave, infrared, visible light, and ultraviolet. Radiation, energy that comes from a source and travel through some material or through space. As we said before, can be non-ionizing and ionizing. Non-ionizing are ultraviolet, visible rays, infrared, microwaves, and radio waves. Ionizing are electromagnetic radiation, which are X-rays, gamma rays, and cosmic rays, particulate radiations, which are alpha, beta, protons, neutrons. Examples of occupational exposure to ionizing radiation. Ask about them during taking patient history. If you suspect that this patient is exposed to any type of radiations, ask about these types. He may be exposed to them. Medical radio diagnosis, radiotherapy, sterilization of plastic or rubber instruments, e.g. IV cannula, detect cracks in gas cylinders or iron bars, detect escape of gases in tube connection, search for undersea or underground petrol during search for undersea or underground petrol, manufacture of cathode lamps. All these can be exposed to radiations. Disinfecting seeds, killing germs for storing, research in atomic reactors and science lab. These are potential occupational exposures to ionizing radiation. Again, ask about them during taking patient history if you suspect that he is exposed to one of them. For example, aircraft workers, atomic energy plant, biologists, cathode ray tube makers, chemists, dental workers, drug makers and sterilization, electron microscopy and operators, electrostatic eliminator operators, embalmers, fire alarm makers, food preservers and sterilizers, gas mantle makers, high voltage electron, X-ray vacuum, radar, television tube makers, users, repairmen, industrial radiographers and fluoroscopy, inspectors using and workers in proximity to sealed gamma ray sources as cesium 137, cobalt 60, iridium 192, and X-rays. Also, this is another list for potential occupational exposure to ionizing radiation. Liquid level gauge painters, luminous dial painters, military personnel, oil well loggers or assayers, petroleum refinery workers, physicians and nurses, plasma torch operators, plastic technicians, prospectors, radium refinery workers, research workers, chemists, biologists, physicists, thickness gauge operators, thorium ore and alloy workers, tile glazers, uranium workers and miners, vet, X-ray aides and technicians, X-ray diffraction apparatus operators. These are various diagnostic modalities and procedures and radiations. Any healthcare worker work near it, he may be exposed. Either non-ionizing radiation as MRI, USG, thermography, Doppler and MRCP, or ionizing. X-ray are used in CT scan, radiography, DEXA, IVP, IVU, HSG, bronchography, ERCP, fluoroscopy, and gamma rays used in PET, bone scan, radionuclide scan. Any healthcare worker working near one of these, he may be exposed to radiation. Ionizing radiation activity measured in units of disintegration per second. Becquerel. Effects of radiation as absorbed radiation measured in gray. To compare effects of different radiations with the reference standard, absorbed dose is multiplied by a weighting factor. The product is called the equivalent dose and is measured in sievert. So we have Becquerel, gray, and sievert. Effective dose. It assigns the various tissue organs the proportional risk of stochastic effect of irradiation compared to uniform whole body radiation by same equivalent dose. It takes into account tissue weighting factor, which depends on the susceptibility of a particular tissue to the stochastic effect by radiation. It is also expressed in sieverts. So, effective dose equal equivalent dose multiplied by weighting factor. Equivalent dose multiplied by tissue weighting factor equal effective dose. SI unit sievert or millisievert. Here this table shows the tissue and the weighting factor for it. Gonads, active bone marrow, colon, lungs and stomach, bladder, breast, esophagus, liver and thyroid, bone surface and skin, and the weighting factor for each. So you can calculate the tissue absorbed by any one. Health effects of ionizing radiation continued. Ionizing radiation either affect genes so appear in progeny. This effect is stochastic. Somatic effect appear in radiated person, either non-stochastic or stochastics. Stochastic means prevalence depend on dose. So the genetic is dependent on dose and some of the somatic. Stochastic prevalence is dose dependent, will lead to cancer and genetic damage. Non-stochastic acute radiation syndrome affects gut, blood, central nervous system. Delayed effects leads to cataracts and dermatitis. Health effects of ionizing radiation continued. Ionizing radiation induces free radicals which attacks cell constituents. This induces lipid peroxidation of unsaturated fatty acids of endoplasmic reticulum and destruction of DNA molecules. يبقى lipid peroxidation and destruction of DNA molecules. Acute effect of ionizing radiation. Sudden exposure to high doses, e.g. in atomic explosions or accidental exposure to radioactive bodies. This will lead to the following manifestations: skin burns, varying in severity, deep ulceration, destruction of mucous membranes, severe anemia, or death. So, skin burns, destruction of mucous membranes, severe anemia, cataract, abortion, or death. Delayed effects of ionizing radiation will lead to cancer, anemia, cataract, congenital anomalies, increased rate of abortion, shortening of lifespan, sterility, and early senility. Again, delayed effects of ionizing radiation, cancer as cancer skin and leukemia, varying degrees of anemia, cataract, congenital anomalies, abortion, shortening of life, sterility, and early senility. Prevention of ionizing radiation, occupational hazards. First, environmental measures, substitution, isolation, segregation, strict regulation, and frequent monitoring of environmental exposure of workers. So, substitution, isolation, segregation, strict regulation, and monitoring of the workplace itself. The medical measures to prevent ionizing radiation occupational hazards, pre-employment examination includes CBC, periodic medical examination, CBC at least every 6 months, and examination of skin or other system affected. Using of PPDs, periodic monitoring by personal dosimeters. Note, exposure to IR should not exceed 5 rem per year. Rem is Roentgen equivalent man, and workers do not exceed half this amount, 2.5 rem, in a 3-month period for the whole period of pregnancy in case of female. Annual dose limit for occupational ionizing radiation. This is important for the general public and for the radiation workers. Whole body for the general public 1 millisievert, for workers 20 millisievert. Lens of the eye 15 millisieverts for general public, 150 millisieverts for radiation workers. Skin 50 millisieverts for general public, 500 millisieverts for radiation workers. Instrument for IR protection, discontinuous prevention. These are the instruments used for measuring radiation for each worker in a place where ionizing radiation is present. Ionization chambers, Geiger-Müller tubes, scintillation counters, proportional counters, film badge, and thermoluminescent dosimeters. So 6 instruments: ionization chamber, Geiger-Müller, scintillation counters, proportional counters, film badge, and thermoluminescent dosimeters. Continued prevention. All the above instruments mentioned in the last slide are portable. First 4 are electronic, measure current radiation levels and capable of giving audible and visible warning signals. Last 2 measure cumulative exposure and are usual devices worn by radiation workers. No one instrument is capable of detecting or measuring all forms of radiation. Most are usually designed to monitor the most penetrating radiation such as gamma or X-rays. Non-ionizing radiation. Infrared. Occupational exposure to extremely hot red objects as in iron and steel industry, ovens, melted metals, glass industry, and etc. Health effects. Heating can induce heat disorders. Main effect is posterior polar cataract. Recent studies indicated that oven workers exposed to infrared experiences will have reduction of spermatozoal count. Ultraviolet radiation. Occupational exposure occur in electric welding of metals, photocopy machines, phototherapy of skin disorders, sterilization and disinfection in surgical and pediatric wards. Health effects of ultraviolet radiation: conjunctivitis and corneal ulcers, skin erythema, burns, but most importantly, skin cancer. Recent study indicated that UV can induce lipid peroxidation in exposed subjects. Prevention: follow general rules of prevention of occupational diseases. The most important is use of protective goggles and protective aprons. Microwave radiation. Exposure to microwave occur mainly in kitchens of hospitals, hotels, and homes. Risk of exposure increase with unsafe use and bad maintenance, ill-fitting doors, which will lead to reflection of microwave to the surrounding. Health effects: microwaves induces heating in deep tissue. Damage can occur without being noticed because superficial tissue or skin escape the heating effect. Electromagnetic fields. Typical magnetic fields: natural fields, main power, electric trains, and cathode ray tube. Typical electric field: natural field, main power, electric trains, and cathode ray tube. These are power lines producing electromagnetic field. Electromagnetic fields with wavelengths less than 0.1 millimeters as ultraviolet and less contain insufficient energy to break molecular bonds and so do not result in ionization. Broad divisions of this non-ionizing radiation include microwave and radio frequency radiation, as well as extremely low frequency, and includes frequency of power distribution. At high frequencies, e.g. microwaves used in communication systems. At lower frequencies, effects of electric and magnetic fields are considered separately. Exposure to magnetic field will lead to circulating currents within body, leading to interfere with physiological processes if great. So muscle activation can occur during magnetic resonance imaging. Low frequency electric fields do not penetrate body but can lead to discharges on body surface. Rare effects include phenomenon of microwave hearing. Some hear repeated clicks when exposed to pulsed sources of electromagnetic fields, usually radars. A visual illusion of flickering lights, magnetophosphines, can be produced when retina is exposed to intense magnetic fields. Units of electromagnetic fields: electric field strength, magnetic field strength, power density, magnetic flux density, or Tesla. In 2001, International Agency for Research on Cancer concluded that there was limited evidence that residential magnetic fields increase risk of childhood leukemia, resulting in a classification of 2B possibly carcinogenic for extremely low frequency magnetic fields. Risk relates to exposure to fields more than 0.4 microtesla, which are relatively large. Any real effects are very small in magnitude. Public concern about effects of electromagnetic fields from mobile phone handsets and base stations. Exposure to radio frequency radiation less than guidelines did not have adverse effect population health, but it is not possible to say that exposures below current guidelines are totally without adverse health effects. So a precautionary approach suggesting that use of mobile phones by children for non-essential calls are discouraged. Till now, no evidence that exposure to electromagnetic fields from use of display screen equipment has any harmful effects. Infrared radiation can cause thermal damage to skin and eyes, both of which can be detected, the latter with appropriate goggles. Both of which can be protected by the latter with appropriate goggles. In developed countries, occupational cataract from exposure to IR is historical. In developing countries. However, cataracts may occur as a result of overexposure to infrared radiation. وأقول في النهاية الحمد لله و thank you for your good listening.